Good afternoon and welcome. My name is Tim Poe. I'm the Director of Telehealth with the UNC Cancer Network. Thank you so much for being with us today. Get us back to the beginning of our presentation here. This is the RN and Allied Health Lecture for August 9th, 2017. Before we jump into the lecture, I want to talk about just a few things. If you have any trouble receiving this, you can email us at unccn@unc.edu. Call our staff at 919-445-1000. We'll be using Poll Everywhere in just a couple of minutes, and we'll talk about that. You can check us out on the web at unccn.org. We're on Facebook, we're on Twitter, lots of places that you can find us. So we do hope that you'll visit our site and find out more about upcoming lectures and past lectures as well. We will be doing a poll in just a moment, and I wanted to preview that first. So the question is, which of the following behaviors is not mandated for field workers by the Agriculture WPS Pesticide Protective Behaviors, PPB? And then there are four answers, and they are A, B, C, and D. A is wearing long-sleeved shirt and long pants. B is wearing closed shoes and socks. C is wearing gloves. And D is washing of hands and face before eating, drinking, or using the bathroom. Now, once you've looked at that poll and come up with your answer, and this is anonymous, you'll go ahead and you can either go online on a computer to pollav.com/UNCCN, and you can answer it there. You can also do this by text, and it's very easy. You text the letters UNCCN to the number 22333. And you do that just one time. That'll get a message will come back saying that you've joined our poll, and then you can answer A, B, C, or D, depending on which of these you think it is. So which of the following behaviors is not mandated? Do you think that's A, wearing long-sleeve shirt and long pants? After joining the poll, you'd put in A. If you think it's B, for wearing clothes, socks, and shoes and socks, you'll put in that. If you think it's wearing gloves, you'll text C. Or if you think it's washing of hands and face before eating, drinking, or using the bathroom, then you'll text us D. But again, first, send the letters UNCCN to the number 22333, and then go ahead and put in your answer. And we'll look at those results in real time in just a moment. We are very fortunate to have Anne-Marie Walton, PhD, RN, MPH, OCN, CHES, with us today. So thank you so much for joining us.
Thank you for having me.
Yeah, we're glad to have you here. Dr. Anne-Marie Walton holds a PhD in nursing from the University of Utah in Salt Lake City. Since 2013, Dr. Walton has been an adjunct faculty member with the School of Nursing at the University of North Carolina at Chapel Hill. She has been a postdoctoral fellow in the UNC School of Nursing since 2015. In addition to these roles, Dr. Walton also served in positions with the Lineberger Comprehensive Cancer Center, the NC Cancer Hospital, and the Gillings School of Global Public Health. Dr. Walton is a 2016 recipient of the Oncology Nursing Society Excellence in Oncology Nursing Health Policy and Advocacy Award. So glad to have you here. Let's take a look at that. Well, one question before we go too far, and let me grab my paperwork so that I can get this just right. But our topic today is pesticide protective behaviors of Latino migrant and seasonal farm workers in North Carolina. So if you can take a minute to just tell us what led you to an interest in that topic.
Sure. So I'm happy to share with you all that I worked as a inpatient hematology oncology nurse here at the North Carolina Cancer Hospital for about 13 years. And it was in that capacity and as a Spanish speaker that many days I was working with patients who would tell me about, if any of you know anything about leukemia, 28-day induction, you have a lot of time to talk. And so in talking with these patients about their work histories, they would say, oh, I've worked in strawberries, or I've worked in tobacco, or I do landscaping. And over time, I became really curious about why these young, healthy men were developing Philadelphia chromosome positive ALL or some type of ALL when they were otherwise healthy and had no family history. So I began to think, with a background in public health before I was a nurse, about their exposures to pesticides and to read about that and to get really curious about what they were actually doing in the field with regard to pesticide protective behavior. So when I knew that I was going back for a PhD in nursing, this was the focus of my dissertation work.
Great. Well, very important work. We're looking forward to hearing a lot about it in just a moment. Let's take a look at that poll. Looks like we're trending with the washing of hands and face before eating and drinking or using the bathroom, with wearing gloves behind that and wearing a long sleeve shirt and long pants behind that. Do you want to let them know the answer now, or did you want to reveal that later in the talk?
Maybe I'll reveal it later in the talk so that folks pay attention. But it's interesting to hear what people think going into the presentation, so that's great.
Good, good. All right. Well, without further ado, I'll go ahead and turn the controls over to you here.
Thank you.
And there's the mouse.
Awesome.
All right.
All right. So as was mentioned, the title of this talk is Pesticide Protective Behaviors of Latino Migrant and Seasonal Farm Workers in North Carolina, and I'm going to talk about a variety of things. The study that I'll talk about first is some of my dissertation work, and then I'll talk a little bit about where the research has gone since then for me and some members of my team, as well as some of my clinical experiences, and then some research that I did looking at documentation of exposure as well. So my hope is that at the end of this hour together, you'll be able to tell us a little bit about actual and self-reported pesticide protective behaviors of Latino migrant and seasonal farm workers in North Carolina, that you'll be able to describe social considerations that may be unique to Latino migrant and seasonal farm workers undergoing cancer treatment in North Carolina, and that you'll be able to talk about the importance of clinical documentation of occupational exposures when it comes to research. So just a little bit of background first. Pesticides can have adverse health effects, and when you look at what these adverse health effects are in the acute arena, they're very nonspecific. So nausea, vomiting, headache, dizziness, and skin rash. And if you think about the role of a Latino migrant and seasonal farm worker in agriculture, these acute effects are probably very similar to the same effects that they would experience from heat. You can think about some of the heat poisoning with headache and dizziness and nausea. And then they're also quite similar for those that work in tobacco to the symptoms of green tobacco sickness or nicotine poisoning. So this is very difficult for farm workers who are in the field to know when they've had an acute exposure to pesticides, because these side effects are so similar to many other side effects that they experience in the field. In the long term, we know that pesticides can cause damage to the nervous system, can cause reproductive problems, and an increased risk for several types of cancers. And these references that I've put on the slide for you can be found at the end of the presentation if you want to read more. The Agricultural Worker Protection Standard, which was already mentioned, mandates that pesticide protective behaviors be taught to field workers within 5 days in the field and then every 5 years thereafter. And just recently, as of January 2nd of 2017, this requirement went to annual training, so not every 5 years, but every year, and no grace period, meaning before their very first day of work in the field. So that's a recent change. When I did this work, which was in the summer of 2014, it was that 5 days and 5 years requirement. So at that time, the Agricultural Worker Protection Standard mandated, and still does, that field workers be taught to wear long sleeve shirts, long pants, closed shoes, and socks, and that they be taught to wash their hands and face before eating, drinking, using the bathroom, smoking, chewing gum, or tobacco. Gloves, which many of you mentioned in your response as being a behavior that would be mandated to be taught, are actually not mandated to be used, but have shown some efficacy in research studies. Hand sanitizer, interestingly enough, was something that we also included in our study because it's been shown to increase pesticide metabolites, and you may wonder why. One of the prevailing explanations for that is that hand sanitizers generally contain alcohol, which will cause small breaks in the skin, allowing more pesticides to enter. Also, the hand sanitizer does not get washed away, so it may create a sticky surface that may further attract dust and residue that would contain pesticides. And I don't know that I included the reference for you there, but it's Coronado 2012 that talks about how hand sanitizer can actually increase pesticide metabolites. So I'll just go over these couple of study goals. So the dissertation work that I did was broader and covered some additional aims, but I'll focus here today on comparing and contrasting observed and self-reported behaviors of Latino migrant and seasonal farm workers, and then talk a little bit about what the farm workers and the growers who employed them thought got in the way of doing pesticide-protected behaviors, as well as the strategies that they suggested to overcome those barriers to using the behaviors that were taught in the worker protection standard. So for this study, there were 3 tobacco farms in one county in North Carolina, and for their anonymity, I can't tell you exactly where it was, but if you know anything about tobacco in North Carolina, this region that I've circled here grows the most tobacco in our state. There was some variation in the number of farms that I employed and the number of workers that were on each of those farms. They ranged from 5 workers on one farm to as many as 60 on another, so there was some variation. Just a little bit about study design here. So I recruited 3 growers, all who had participated in the Certified Safe Farm program. So the Certified Safe Farm program is a program to reduce agricultural injury, and it's here in the state of North Carolina as well as in Iowa. And neither growers nor the farm workers knew that I was focused on pesticides. They simply knew that I was a nurse that was interested in how people kept themselves safe at work, so they didn't know exactly which behaviors I was observing. I collected data sequentially across these 3 farms, which meant that they might be doing a different work task. On the first farm, they were getting ready to put the tobacco into the ground, and on the very last farm, they were putting things into the barn already. So I saw a variety of work tasks. I observed each of the farm workers that participated in my study in the field somewhere between 6 and 12 and a half hours. And that range is really based on how long they individually were working that day, and that may have been dependent on weather or how much there was to do. And then I returned with a member of my study team, who's pictured here with me as well, to do questionnaires and targeted interviews for farm workers on the following Sunday evening. So after they were observed, I went in and asked them what they normally did. And then growers were interviewed last. So I wanted them to be aware of the kinds of questions that I was asking the farm workers, but not until after I had asked them, so that they wouldn't modify the responses of the farm workers in any way. And in total, there were 71 farm workers that I was able to observe. One worker was more of a work supervisor and had tasks that were too dissimilar from the other farm workers. So here's a little bit about my sample. As you can see, the majority of farm workers were men. All of the growers were men. I think I'll just tell you the farm worker characteristics first. So the majority of the farm workers were men. They were an average age of 33, though you'll see a huge range here between 18 and 68. And I myself was surprised to find in the field sometimes dyads of grandfathers and grandsons who had left parents back in Mexico to continue to work and raise younger children while they came to the States together. There were also brother dyads, cousin dyads, and certainly lots of groups of friends. Education may or may not surprise you that 89% of the farm workers had a middle school or less education. They had worked on average 6 years in the United States, 12 total in agriculture. 97% were compliant with pesticide safety training in the last 5 years, because I was going by the requirement for the WPS as it was at that time, and had that training in 2012 or later, so were compliant with the 5-year rule. 97% of my sample was from Mexico, and 90% were on a work contract, and specifically an H-2A visa. When it comes to the grower group, you can see that 100% were men. They were an average age of 51. All had more than a middle school education. 41 years in agriculture on average, which tells you that these farmers were doing agriculture from childhood, doing agricultural work. They were all compliant with pesticide safety training in the last 5 years. So many people ask when they hear about the kind of work that I did, well, how do you observe, and how can you be systematic about observing people in a field? Do you just take field notes? What do you do? And so I created this observational tool, and you'll see here that there are 30-minute time blocks for each person that I observed, and these are the behaviors that I was looking for. So in each one of these 30-minute time blocks, I checked whether or not I saw that behavior. As you can see, some are grayed out. So eating and drinking If those did not occur, I would naturally not see the two behaviors that followed them: washing hands before eating and drinking, washing face before eating and drinking. Socks, I found early on, were very difficult to observe. The majority of farm workers wore boots, and so it was difficult to tell whether or not there were socks underneath. So here are some of the findings on self-reported and observed behavior, and this is a busy slide, so I've put the arrows there to help you. The green arrows signify where people reported what they actually did. So when it comes to wearing of closed shoes, you can see that 66 people reported, yes, I always wear closed shoes, and 65 of them were actually observed doing that in the field. So there was no significant difference. People did what they said they did, and in fact they did it at pretty high rates, for 66 and 65 of 71 farm workers to be doing that behavior. The same was true with the wearing of long pants, even higher. 71 reported it, 70 were observed doing it, and so you can see that they were very compliant and they reported what they actually did. The wearing of socks I've already discussed. That was really difficult to see, and so even though 70 reported doing it, I was only able to see 11 wearing socks because they were just difficult to see. What was slightly more concerning was the wearing of long sleeves. You'll see that 69 people reported that they always wore long sleeves, but only 64 were observed wearing long sleeves all of the time. And the reason for that difference is that very often the farm workers began the day in long sleeves, but as the heat of the day made them weary, they would roll their sleeves up over their elbows, no longer making them able to count as a long sleeve shirt or being completely protective. What's most concerning, though, are these 4 arrows at the bottom that have to do with washing, and you'll see the significant differences here. So I should mention first that there were people that I could not see eat or drink in the field, so I did not follow them if they took a standardized lunch break into wherever they were eating, and for some they went back to their own housing, so I did not go with them into their homes. But I was able to see eating in the form of snacks, and I was able to see drinking in the field. So there were 2 people that did not drink at all, which is why the total N for drinking is 69, and there were 30 people who did not eat at all while in the field, making the total N for eating 41. But despite that, when you look at this, you can see that people were reporting that yes, they did. 65 of them said, yes, I do wash my hands before eating, but I only consistently observed that 7 times. So you can see a very significant difference between what people said they did and what they actually did in the field. The same true for face. 46 people say, yes, I do wash my face before eating. I never saw washing of the face in the field before eating or before drinking. Same true for hands. 41 reported, yes, I wash my hands before I drink, and I did not see that consistently in the field at all. So I'll talk a little bit now about some of the qualitative findings. So this is what came out of interviews with farm workers and growers on those Sunday evenings and at the conclusion of the work with farm workers in the case of the growers. So when asked what got in their way of doing pesticide protected behaviors, at first 70% of the farm workers said nothing. But over the course of the interviews, other things began to emerge, and wetness was one of the things that began to emerge. So here are some of the quotes from farm workers. The shirt starts getting wet, and that's how one starts having contact with the pesticide. When one starts to sweat, the pores open, the anxiety begins. If you're not careful to bathe or wash your hands before eating something, since you have your pores open, you get dizzy or vomiting, because as a worker, you have your pores open because of the sweat. And these have all been translated from Spanish, so they're not the cleanest reading in English, but what you can hear is that the farm workers were aware that once their shirt was wet, there was the opportunity for the pesticides to, for their shirt to be porous and for the pesticides to pass. 33% said that heat got in their way of doing what they knew that they should do, and 10%, it's translated here as laziness, but there's a dual translation of this word that they used as fatigue, and that may actually be more accurate, that 10% said that they were too fatigued to do what they knew that they should do. When I asked them what they thought could help them to do more pesticide protective behaviors, a variety of promising and problematic strategies emerged. So in the promising arena was to have supplies on hand, to prepare a backpack and change at midday once they were wet, to communicate warnings to one another, and to have additional training. Interestingly, I pulled the training video that the majority of the farm workers watched, and less than 1% of the time in the video was spent on washing behaviors. So in a 40-minute video, about 40 seconds was spent on washing behaviors. Also problematic was that farm workers talked about using suero. Suero is a combination of electrolytes and water, so kind of like a Pedialyte that farm workers use to feel less hot in the field. But suero doesn't do anything to minimize exposure to pesticides, and there was some myth that that would help them to feel better. Likewise, drinking milk. We know that drinking milk is helpful in acute pesticide poisoning to neutralize pesticides, but drinking milk prophylactically doesn't actually help to minimize exposure to pesticides. And some of the farm workers said in interviews, I drink milk several times a day because it helps me to feel better. Sorry, I need to go back there. Thank you. And then using medications and ointments. There are no medications or ointments that prevent against pesticide exposure, simply those that might make one feel better if they were to develop a skin rash or some other complication as a result of exposure. Here in yellow, I wrote that we observed the regular use of hats and water-resistant outerwear, and the reason I put that in yellow is because we don't know whether that's promising or protective. There's not enough research on the type of hats that they were wearing, predominantly baseball caps, as whether or not that would actually reduce exposure to pesticides, or water-resistant outerwear as well. Many of them wore trash bags with a rope to minimize their exposure to morning dew, which would help keep their clothes dry, but would also increase their risk for heat illness. Okay, so the role of experience and training, I'm just going to spend a minute here. It was interesting when I took the demographic data with our findings and looked across, and we saw that those who had more training had more perceived susceptibility to illness and were more likely to find protective behaviors effective. Also interesting is that those with more experience used less protective clothing, and this has actually been my experience as a healthcare worker as well. So I think that this may have some veracity across disciplines. I find as an oncology nurse that those who use the least PPE are those with the most experience, and when I've talked to them about why that is, they'll say, well, I'm past my baby making years, or I haven't gotten sick yet, and so if I haven't gotten sick yet, I must be okay. And I think that's very similar in the farm worker community, that they believe that you sort of build an immunity to this exposure, and if nothing has happened to you, then you're going to continue to be okay, or you know that you yourself are not going to have any more children. But you have to think about these behaviors as part of a culture and creating a culture of safety in your work environment, be it in the healthcare work environment or in agriculture. And as I mentioned already, the training video spent only about 1% of the time on washing behaviors. So some additional opportunities for research. I think I was able to show pretty clearly all of the literature about farm workers to date, especially in North Carolina, has been self-report of behavior. And I think I was able to show that self-report shouldn't be used in place of actual behavior. And I think you can think of lots of reasons why people may tell you what you want to hear when it comes to what they do in the field. We should also include non-tobacco farms and non-safety oriented farms. I will admit that these were some of the best possible farms to observe because they were already enrolled in the Certified Safe Farm program and very oriented towards safety. We should explore the efficacy of these farm worker strategies like hats and water-resistant outerwear and see whether or not some of these behaviors that they've adopted and believe to be protective actually reduce their exposure. When it comes to practice, education to reinforce the importance of washing behaviors in the field is needed, and I'll talk a little bit about some work that we've done as a result of this study. Tailored training in tobacco should include behaviors that decrease risk for green tobacco sickness and pesticide exposure and even heat. As I mentioned from the beginning, some of the acute effects of pesticide exposure are very similar to those of other problems that one would encounter in the field. We found that moderately experienced workers had the most protective behavior, those with about 9 years of experience. And I think that makes some sense, that people who are brand new to agricultural work are so overwhelmed that they may not be at the best of their safety practice, and those who are later in their career may perceive that they no longer have the same risk profile and do less. So moderately experienced workers may be the best peer trainers. More frequent training may be beneficial. Provision of adequate supplies is required per the field sanitation regulation, which is different than the worker protection standard. And it says that growers have to provide soap and water for washing within a quarter mile of wherever the farm workers are. And I can tell you, as a result of doing an observational study here, that what I found was that there was adequate provision of supply 2/3 of the time. So about 67% of the time the grower supplied soap and water, and then if you take that pie of the 67% of the time and make it a new pie and look at it that way, farm workers used that equipment, that soap and water, about 1/3 of the time. So you can see that there is responsibility on both the part of the grower and the farm worker when it comes to improving hand washing in the field. But I did also find that they were very collaborative and that farm workers and growers could work together around safety issues. If you would like to know more about this particular study, these are 3 of the papers that have come out recently as a result of the dissertation work, and they'll be in your slide deck. Before I move on to other things, I'd like to see if anyone has questions about this study in particular.
All right, so this is where we open this up for questions. You can, again, go ahead and join Poll Everywhere by just going ahead and sending to the number 22333, the letters UNCCN, do that one time to join, and then you can just go ahead and text in any questions that you have. Once you've initiated that, you can also go to pollev.com/UNCCN, and there'll be a place there to submit questions as well. All right, we have our first one. Did you ask the education levels of the growers?
I did, and if I can, am I able to go back?
Absolutely.
Where you can see? Okay, great. I did, and here it is. So I only broke out here middle school or less, and as you can see, 0% of the growers, there were 3 growers, had middle school or less education. All of them had high school or above. So these were pretty well educated, definitely completely literate growers who were taking part in the Certified Safe Farm program as well, so very motivated towards safety.
We can go back and we'll see if that, while we're waiting for other questions to come in, I had one. Talking about pores and exposure with pores, is there any difference between using hot water or warm water and soap versus cold water and soap in terms of opening or keeping the pores closed?
That's an interesting question. So there is some literature about farm workers being concerned about using cold water, which is very frequently all that's provided in the field. So in some cases, the water that's provided is the same for drinking as it is for washing, and it's provided with one of those sort of put your foot on the step and the water comes down out of a big jug kind of thing. Same for drinking and for washing in some places.
Okay.
And so that can be quite cool. And there is a belief among, and there's some writing about this, among Mexican farm workers in particular, that that would cause joint problems to have cold water on warm hands. And so they're reluctant to wash in cold water. I didn't find that to be something that came up in the course of my study, but with regard to how that, if that has any effect on the opening or closing of the pores, I'm not sure. But that issue of the temperature of washing water is one that has come up in the literature culturally.
But there's not anything conclusive out there in terms of would cold water or warm water be more likely to inhibit the pesticides, the absorption of the pesticides?
I think I'm not aware of any. I think what's most important is that you're actually scrubbing and washing off the pesticides that are on the palms of your hands.
Gotcha.
So it's that soap and water action and rinsing that's so crucial.
Great, thank you. Looks like lots more questions. All right, how did you choose the farms? Were these the only farms? Were these the only farms asked to participate or willing to participate?
Great questions. So I chose these farms because they had participated in the Certified Safe Farm study, which meant that they had participated in a study in the past. So I knew that these were growers who might be motivated to say yes. I did approach all of the Certified Safe Farm growers in a particular county. I can't tell you which one. And I will tell you that in that county there were 7 growers that had participated in Certified Safe Farms, and only 3 agreed to be in my study. When I asked those who refused to participate why, they were very concerned, frankly, about me standing in their field observing and not saying exactly what it was I was looking for. There is some very polarized lay literature about growers and farm workers, and many of them have been burned with that kind of newspaper footage in the past, and
Gotcha.
So they were reluctant to participate. So that's a good question.
Gotcha. Thank you. Does your work with leukemia doctor? Do you work with leukemia doctors to do occupational screening or new leukemia cases?
So this is a really good question, and this work made me do, or concurrent with this work actually, I did a deep dive into documentation of occupational screening, and I'll talk a little bit more about that later in the presentation.
Great.
So I won't talk about that here.
Sounds good.
I can also see this next one. How was the reception of the growers? And I will say that the 3 growers who participated with me were phenomenal. Very happy to have me there, very happy to have myself and my study team who spoke Spanish, and were excited to hear what the farm workers thought could be being done better, even used the opportunity to ask questions like, do they have a preferred hand soap? We're providing Dawn. Is that okay? Is there something that might make them wash more? So they had a very collegial relationship by and large, these growers and farm workers. But again, I was working in some of the most safety-oriented farms.
Sure. Interesting. The next one. So did the study actually impact the motivation in terms of increasing washing and protective behaviors?
Good question. So I did go back and give study results to everyone who participated in the study. Unfortunately, it was the following summer by the time all of the data analysis was done. So as you all probably know about migrant and seasonal farm workers, you don't always get the same set back year after year. But those who recognized me and who had participated were very actively listening. And I did also talk about some of the immediate but also long-term effects, which I don't think are stressed about exposure to pesticides, and they seemed motivated, but there was no follow-up study to see if they really changed their behavior as a result of participation.
Gotcha. All right. Did any of the growers state what motivated them to join the Safe Farm program? Do you have any idea what percentage of North Carolina farms are in the Safe program, the Safe Farm program?
Good questions. So it's a very small percentage of North Carolina farms that are in the Safe Farm program. I'm positive that it's less than 5%, but I'm not sure how much less than 5%. So very few are participating. But there is actually a financial incentive to join the Certified Safe Farm program. So for growers who agree to make some of the changes that are recommended by the Certified Safe Farm team, they're actually given 50% of the cost over a certain amount to make those changes. So for example, if the study team sees very old equipment that needs to be modified or a structure in need of repair and they make that recommendation, they will very often help with money from the Tobacco Trust Fund to fund those repairs.
Great. Did the workers report that they used, what they used to control symptoms of GTs?
So if that's great, I think that's grain tobacco sickness, and they didn't report what they used to control their symptoms. I mean, you'll read in the literature that several of them begin to smoke because they believe that additional exposure to nicotine will actually minimize their own response to the green tobacco. That didn't really come up much in my interviews with them. So no, they didn't. These creams and ointments that they talked about were for skin rashes. They seem to be using some sort of cortisone cream. But no, they didn't really talk much about what they were doing there.
Somebody expressing surprise that masks are not mandated.
Yeah, masks are not mandated, again, for field workers. Mm-hmm. So these folks, if you think about tobacco in particular, are those that are, they may be topping and suckering, so taking the flowers off of the tobacco plant. They may be harvesting, taking the leaf off, putting it under their armpit, walking it to be barned. They may be barning. But yes, masks are not mandated. And in fact, face covering, which you'll see some people use with like a handkerchief, may actually not be beneficial because it may keep things very close to their face. So yeah, masks are not mandated. There are certain respiratory masks that for certain behaviors or pesticide application are definitely mandated.
And then this last question, and then we'll stop with questions here, but there'll be another opportunity at the end of the presentation to ask more questions. And thank you so much. This is great, all the questions we've had. Yeah, so is there concern about people working out in the fields bringing the pesticides back home with them?
Absolutely. So part of what the worker protection standard mandates be taught is that workers remove their clothing immediately upon return home and not bring it into the home so as to not to contaminate others in the house. There's some great studies about that as well, and who does and who doesn't, and actually they've looked at wipe samples of floors in farm worker housing to try to estimate what toddlers and babies who are crawling on the floor actually pick up in terms of pesticide residue. So there's some fascinating work being done there, but there's definitely concern. So what's recommended is that you, just like we recommend for healthcare workers, kind of strip at the door, and for pesticides in particular, that you wash work clothing separately from non-work clothing, that you wash it twice in hot water, and that you hang it to dry so that it has that extra sun to help break down the pesticides, and also so it's not remaining in the bed of your dryer.
Yeah. And I'm assuming that not everyone in this population we're talking about has ready access to washer and dryer in their home, which probably complicates that as well.
Yeah. The farms that I was at, especially where I did the Sunday night interviews, did have one or two in particular did have washing machines and then lines for drying. So there was not provision of a dryer.
Yeah. All right. Well, let's go ahead and advance on to the next slide and continue the presentation. And then again, there'll be more opportunities for questions at the end.
Great. Again, I'm really grateful for your interest, so thanks. And I'll just talk a little bit about where we've gone from here with this work. So in part of dissemination of the dissertation results, I gave a presentation to the North Carolina Farm Worker Health Program because they do a lot of work with outreach workers who train farm workers to do good pesticide protective behavior. And they were interested in my help to improve hand washing educational materials. So a colleague and member of my dissertation team and I conducted a series of focus groups and administered questionnaires to farm worker health outreach workers across the state who were associated with the Farm Worker Health Program. And then we created this toolkit, which you'll see a picture of down here. It is a product called Glow Germ, and there's a black light and a series of activities that we made up to show farm workers what it's like to have pesticide residue on your hands, the importance of washing, how much pesticides actually spread. So we created an activity that involves use of a cell phone, which is something I saw a lot in the field, so that they could see that every time they open that phone or answer a text, put the phone to their face, they're actually increasing their pesticide exposure and the number of places where they're distributing that pesticide. We are currently seeking some funding to test the efficacy of this toolkit among farm workers and farm worker health outreach workers across the state. So for farm workers, we want to know if it improves their knowledge, their skills, their intentions to change their behavior, and the behavior itself. And then for outreach workers, we want to increase knowledge, self-efficacy, and learner-centered practices. We also formed a farm worker health research collaborative with outreach workers over the last couple of years, and we're asking them what they think real priorities are for research within the farm worker community. So I'm going to shift gears a little bit as Tim mentioned or asked me at the beginning, why did I get interested in this in the first place? It was because of my clinical experience as a hematology oncology nurse. And it made sense for me to focus on protective behavior given my background in health behavior and health education for my MPH, my own personal experiences, and then my curiosity about the observational method in particular. I continued to care for patients while I was conducting my research. I actually practiced until 2016 and saw fewer Latino migrant and seasonal farm workers on our units over that time. So I wonder too if there has been a shift in where they're seeking care. And I'll talk a little bit about some of the lessons that I've learned working with patients, Latino migrant and seasonal farm worker patients in particular, over the years. So language barriers I found go beyond the obvious. It's not just a matter of whether they are a Spanish speaker and you are an English speaker. In Mexico, there are very many native languages in use. Your patient may not speak Spanish, they may speak the Tarahumara indigenous language. And so if they're not understanding Spanish, it may be that they're not a Spanish speaker. Also, I found that there was a difference between rural and urban language. For many of the farm workers that I cared for who had lived rurally and were not formally educated, they would sometimes refer to body parts in words that I didn't know. And when I would look them up, I would find, oh, that's the belly, but it's the belly of a pig, or it's the belly of a cow. And so for those who were living rurally and doing agriculture where they were, those were the words that they were familiar with and the words that they were using. Migration makes follow-up care very hard, especially for those who have a serious illness where they need to be followed. You can imagine for a farm worker who may work on the Eastern Stream, going between Florida and all the way up through North Carolina, that finding providers on that stream may be difficult. Providers have to be willing to spend time and energy questioning their own assumptions and gathering information from these workers. There may be dual families. I came across that quite a bit. You would ask someone about their family and they would say, I have 2 children in Mexico and I have 1 here in the US. And the more that you came to know them, you understood that they had formed another family here. That wasn't the case so much in my dissertation work where people were traveling back and forth to Mexico for work, but more the case in those that were seasonal farm workers and staying here and doing that work through the season that I was caring for clinically. Bringing family in at the end of a patient's life or bringing patients home to die, I learned may be considered catastrophic, and so there was a special social worker here at UNC. We didn't use the usual social worker for the floor. We used the catastrophic social worker who would help us get through the consulate and all of that was needed to bring family members to see someone at the end of their life or to get someone home to die. The caregiver can be very non-traditional. The caregiver can be a boss. It could be a second partner. So it's important to question your assumptions about who should or should not have information about the patient and who the patient is choosing to include. And then I gained a lot of insights too from working with outreach workers to identify what they think are priority areas for research over the last year or so. And they talk a lot about issues with accessing specialty care services, providers' lack of time, lack of cultural understanding, and the expectation of people in the farm worker community to receive something as a result of a medical visit. So they described it being frustrating for a patient to leave with just another appointment and not to feel like they had gotten something that they should be taking or doing as a result of that time. So I'll shift gears again just a little bit and mention that I did a chart review looking at the documentation of providers because I really wondered if I could see documentation of exposure to pesticides in the medical record. So I looked at 115 patients who had a diagnosis of acute leukemia, and 98 of them were asked about their occupation. So we didn't even ask the occupation of some. Of those that we didn't ask, so that difference between 98 and 115, so 17 patients, 10 of those 17 were women. And so again, I think we have to think about our assumptions as providers, assuming that perhaps a woman, is not working. When I looked at industry and occupational codes and did a review of the literature, the occupations that those 98 patients were in, of those, about a third of the sample would have been in occupations that were considered at high risk for leukemia. And an exposure assessment was done for only 2 of those people. One was a farm worker, and they asked about exposure to pesticides, and one was a factory worker, and they asked about exposure to asbestos. So there is, from the Agency for Toxic Substances and Disease Registry, a card called I Prepare, which talks about how to do an environmental exposure assessment regarding employment and even beyond. And that's something that I would definitely recommend for providers who are documenting exposure, because it's very difficult as a researcher to try to make these connections between exposure and a known diagnosis if we're only asking in 2 cases to do a real exposure assessment, even on those who would be considered at high risk for leukemia. And if you're interested in reading more about that study, the reference is there for you as well. So I'm happy at this point to open it to questions about the clinical care component or the documentation review that I did, or anything more broadly. And I've also left an email address for additional contact.
Great. Well, thank you so much.
Sure.
Let's go ahead. We'll advance one and see if we've got additional questions. Whoops.
Oh, and those are references for you if you are interested in reading more about anything documented.
Okay. And that's on the slide presentation that you can get off our site as well, and through Sakai. So did you get the impression, or did you discuss with the workers if they have been educated on reporting grower non-compliance with washing stations? And then it looks like they may have gotten cut off. I'm guessing they were starting
perhaps.
to say perhaps.
Yeah.
So feel free to send the rest of your thought in as a follow-up text.
And my guess is perhaps they didn't know how to report if they didn't have what they needed to do the washing. I didn't discuss that specifically with them. If they knew how to put in a report. We did talk a little bit about whether or not they thought their grower, the grower that they were working for, considered pesticides to be risky or dangerous and took it seriously. And again, on these farms that were I see the rest of it, perhaps they wouldn't feel safe. Did any supervisors tell them to wash? So in continuing to answer this question, I see where you're going. I didn't specifically ask that, so I don't know if they felt safe in reporting or didn't feel safe in reporting. Did supervisors tell them to wash? Not in the time that I was doing observation, but I will also tell you that the supervisor or grower, as that's the person that I interviewed, was not with us in the field. So usually there was either a formal work supervisor or an informal work supervisor that was going out into the field with us, and the grower was back doing additional tasks, so they weren't actually in the field with us.
All right. How will you get buy-in from providers to do screening or exposure assessment here?
Isn't that the $1 million question? I really don't know. In writing that paper and taking that look, just to say this is really a missed opportunity here. It's a missed opportunity to document exposure and to contribute to research. And again, much like with my dissertation work, I'm sharing the results of that review, but I'm not really sure how to motivate beyond education.
Gotcha. Are there currently any efforts that you're aware of as far as legislation to provide a more protective environment?
So I think this question is specifically about providers doing screening and exposure assessment, and I'm definitely not aware of any legislation in that area recommendation for sure. When it comes to legislation for keeping workers safe, the worker protection standard, the worker protection standard was just updated, and I think there were many wins for the farm worker community in the update that came out in 2017. There are still things that we would like more of. The field sanitation regulation is also there to protect farm workers. I think one of the problems, and this is also well documented in the literature, is the number of employees that exist to do inspection of sites and to make sure that people are compliant with the rules that already exist.
Okay, well, thank you. Let's see. Please repeat where the I Prepare cards come from? Have you tried to do any training for providers at UNC Hospital?
So the I Prepare cards come from the Agency for Toxic Substances and Disease Registry, and I don't have the citation for the paper in this presentation, but if you go to the paper that we wrote in 2016 about documenting occupational exposure, the original citation is in that paper, and so you can find the I Prepare cards. You can also look online on ATSDR website and find them. I have not tried to do any specific training for providers at UNC Hospital. I think what it really would require to become part of the culture is that it would be part of EPIC, and it would be part of what we do when we do an intake assessment, is talk not only about occupation but about occupational and other environmental exposures.
Interesting. Has that been discussed today that you're aware of?
Not that I'm aware of.
Okay. Mm-mm. All right. Let's see. How would knowing a patient's environmental exposure risk affect their care or treatment?
So I don't know how much it would affect their care and treatment. Mm-hmm. I know that it would greatly contribute to what we're able to do from a research perspective and what we know about causation and what we know about prior exposure. But I do think it would affect what we teach for those who are going back. So I always, in the clinical setting, use the opportunity to educate about where I knew that the person was going back to. So being able to talk about continued prevention for the rest of their life in terms of exposure to pesticides or exposure to asbestos or whatever it is that you knew was a hazard in their life could then be focused on.
Can patients ask their provider in oncology or occupational health to do exposure assessment?
Sure, and I would think that those who are occupational health providers would be even more comfortable and familiar with the kinds of questions to ask. But the card that I mentioned, the I Prepare card, makes it very clear, the 7 or 8 questions that should be asked as part of that assessment.
All right, and someone wondering if your PhD is in nursing or occupational health?
It's in nursing, so I have learned some of this occupational health stuff on the by and through mentors who are occupational health nurses, but I have a PhD in nursing.
Great. How does North Carolina compare with other states in heavy agriculture like California from a safety perspective?
That's tough. I know in the pesticide literature, there is quite a bit of pesticide safety literature that comes out of California as well, and I think the issues are similar in terms of time, what the barriers are that are written about in both California and North Carolina in terms of how well we comply in comparison to California. That I really don't know.
All right, we have just a moment or two left. If you have any additional questions, Dr. Walton, I've got to say, I think you may have set a record for the number of questions in one talk.
Great.
If not, you came very close to it. And to me, that's very symptomatic of an excellent lecture when we get this many questions.
Thanks.
So we really appreciate all of the participation from the audience. We are going to go ahead and grab the keyboard, and we'll advance a couple of slides. You do have references listed here, and so that slide deck is available.
Oh, and actually, I'm sorry, will you go back? Number 10 is the I Prepare card.
Oh,
good.
Great.
It's there.
Great.
So it's that Paranzino Butterfield reference.
Okay, great. So for that question just a few minutes ago, there it is, item number 10. All right. We want to thank the General Assembly of North Carolina for their generous support of the University Cancer Research Fund, which funds our program, and the UNC Lineberger Comprehensive Cancer Center. We want to thank Lineberger Comprehensive Cancer Center as well. We want to thank Mary King, Veneranda Obore, and Alan Brown for all the magic they do and hard work to make this happen. We have more lectures, always more lectures, and we hope that you'll consider attending some or all of them, including on August 23rd, Medical and Surgical Oncology Lecture, Renal Cell Carcinoma, Past, Present, and Future, with Dr. Rose. On August 25th, the Community Lunch and Learn. These Community Lunch and Learns are not for credit, but we say they're for anyone who's been touched by cancer, a cancer patient, survivor, caregiver, family member, etc. In this case, it's called, it's a lecture on cancer, what people struggling with cancer want to know. And this is with Melissa Holt. We hope you'll be able to join us for that on noon on the 25th of August. And then on September 13th, another one in this series, the RN and Allied Health Lectures, Management of Malignant Pain in the Era of an Opioid Epidemic. And that's with Dr. Keisler. So hope you'll be able to attend all of those. You can find all of our events coming up, and we have months and months planned ahead, and we'll always have more at www.unccn.org/events, or just by going to the site, clicking on the events tab. Thank you so much for participating. Check out our site at unccn.org. Find us on Facebook and like us, tweet about us on Twitter. Join our subscription to the monthly newsletter, where you'll find out about our program as well as all of the events, and you can just send us an email at unccn@unc.edu. Say, hey, I'd like to be on your newsletter list, and we'll go ahead and you'll start receiving that starting at the beginning of September. All right, until our next lecture, thank you so much for being here. Dr. Walton, thank you so much again. We really appreciate having you here.
It's been a pleasure.
All
Thank
right.
you.
Thanks.